Good morning and welcome to another session of Heart to Heart. And it's my pleasure to welcome my colleague, Dr. Paul Garrett, who is going to talk to us about calcium scores today. Dr. Garrett trained at Tulane Medical School and Brooke Army Medical Center. Welcome, Paul.
Thank you.
So what is a calcium score?
Calcium score is a simple test where we do a non-contrast CAT scan of the heart where we're looking for calcified plaque. Calcium is essentially what's in bone, so it lights up on a CAT scan very easily and allows us to see if you maybe have some early plaque in the arteries that otherwise may have been undetected.
So currently, if a patient comes into a doctor's office and wants to know their risk for having a heart attack or stroke, how do we do that, and how does a calcium score add to that?
So traditionally, we know all the standard risk factors, smoking, blood pressure, cholesterol, and so we have risk scores for that. What the calcium score adds to that is when you have somebody at intermediate risk or in between, so they're not very low risk and they're not very high risk, you can do a calcium score and that'll help what we call risk stratifier, determine if they're more low risk or higher risk. So you do your basic risk stratification, and in the right patients you do the calcium score, and then that allows us to better delineate who's at higher risk and who's not.
Tell me a little bit about plaque. And I understand plaque is embedded in the vessel. What does the calcium score actually tell us about plaque?
So plaque in a coronary artery is really an inflammatory process, and it's an injury to the artery. So one question we get is, oh, do I eat too much calcium? So just like if you twist your ankle over and over, that injury, ultimately your body's trying to heal it and it lays calcium on there. So calcium becomes part of the embedded fatty plaque. Now there are other parts of that plaque, but the calcium is easily detected, so we use calcium as a surrogate for other plaque. So the more calcium you have, the more fatty plaque and atherosclerosis you have, and then obviously once we know that, we can more aggressively treat it in the right patient and prevent the long-term outcomes.
Recently, has a calcium score helped you manage a patient in your clinic?
Oh, absolutely. I mean, we all unfortunately know patients who, 55, think they're healthy, and they come in and then suddenly have a heart attack unexplained, even before they have symptoms. So a calcium score, we're surprised every day. Sometimes you get it, it's totally normal and it's reassuring. Other times it's way high, and then you do further testing and find out they actually have extensive coronary disease that they didn't know about.
So it can actually be a test that helps you treat patients more aggressively with diet, exercise, and a statin or other lipid-lowering drugs. But it can also be used for reassurance if somebody's extremely worried about having a calcium score might be useful in that situation too.
Right. So the newer guidelines indicate the use of statin therapy or cholesterol medicine. If they're in that intermediate risk and their calcium score is totally normal, you may hold off on statin therapy and allow them to diet and exercise and monitor a little more closely. However, if they come back with a high calcium score, they need aggressive treatment immediately, and so we treat that. So it's very helpful, and it has changed how we do things.
So Dr. Garrett, who should have this test?
Well, it's really designed for people at intermediate risk, so people who are 40 to 70 years old who have some traditional risk factors but don't have known coronary disease. So if you're 60 and diabetic and already have had a bypass surgery, a calcium score is not that helpful. If you're 50 with some high blood pressure, mild elevation of your cholesterol, but no known coronary disease, that's the perfect person to have that scan, because that way we can determine if you're at high risk or low risk.
CT scanning is very useful when it comes to cardiovascular disease. Another use of this technique is in CT coronary angiography. So can you tell me a little bit about that? I know you've had a lot of cases recently where
So CT coronary angiography is kind of the next level of CAT scanning of the heart. Some people use the term virtual heart cath. So in a CT coronary angiogram, we actually put in an IV and inject contrast like we would at a heart cath, but rather than having to feed catheters up to the heart and go into arteries, which has some risks involved, we're able to see the heart. So CAT scan is a dynamic picture of the heart, and it used to be that we couldn't get a picture of a moving heart, but now with technology, the CAT scanners are fast enough, we can image them quick enough to where we can really stop the heart and recreate 3D images. So we can see the heart arteries on a good scan almost as well as a heart cath and know whether you have blockage or don't have blockage without necessarily having to go in with a catheter.
Well, that's really exciting, Dr. Garrett, and thank you very much for spending some time with me this morning. If somebody wanted to get in touch with you, how could they reach your clinic?
Well, just reach out to our office at 767-3900. Tell them you want to get in and be evaluated or want to get a calcium scan to view that, and they can get you to the right spot.
Very good. Thank you very much. And this concludes another session of Heart to Heart. Looking forward to the next one. Thank you.